Okay, so welcome everyone. I'm here with Karl Monahan. He is a physiotherapist in London, correct?
I'm a sports and advanced clinical massage therapist by trade.
Oh, very nice. So you've got the benefits of all.
Not a physiotherapist, and I always make that really clear from the offset, so to patients and to anyone else.
Okay, wonderful. Well, you're helping patients, and you're doing wonderful work, from what I gather. So I'm going to stick with the script. I'm going to introduce Karl formally. Karl has had over 16 years of clinical experience. He's been working in the men's health field since 2006, when he started to work at the Prostate Centre in Wimpole Street, London, working alongside UK's leading prostate specialists. It was there that he received an opportunity to offer treatments for chronic prostatitis, otherwise known as chronic pelvic pain syndrome. In 2009, he carried out a small study on the benefits of our Vigo massage in the treatment of chronic prostatitis and chronic pelvic pain syndrome. The results were positive, and he was given the green light to offer treatments at the Prostate Center. A year later, he was invited to Mexico to lecture on the benefits of our Vigo massage for the treatment of male pelvic pain. Since then, he's continued many studies into abdominal and pelvic health treatments, pain management processes to bring the most up-to-date treatment protocols to his patients. He was the first to set up the UK prostatitis support groups, something that he's eager to bring back as an online support group for others. He's in the early throes of developing patient-focused educational groups specifically for chronic pelvic pain syndrome and chronic prostatitis. He's lectured up and down the country to large corporate companies on prostate health. He's also part of the Pelvic Health Group, a group of experts based in central London who specialize in both male and female pelvic pain. He will be one of the 5 lecturers at the Pelvic Health Group Educational Evening on Thursday the 24th of November on practical applications to desensitizing chronic prostatitis and chronic pelvic pain patients. He plans to start your master's in pain management next year to deepen his knowledge base in pain and pain management. So tell me a little bit about that. What's this master's program?
So it's to understand the applications and principles around pain itself as well. So pain is such a complex process that understanding a little bit more about the physiology of it, the biological approach to it, how we can apply it to patients and to actually teach them individually, and then also for things like my educational programs for my patients or group educational programs. So it's basically just to fill me with a little bit more knowledge, to fill some more stuff in here. There's plenty of space up there. So
student for life, right?
I'm afraid so. That's my sentence.
It's beautiful. I am too, likewise. Wonderful. Well, on that note, tell me, I understand that you've had your own experience through pelvic health. Explain a little bit about how you kind of got into this field of work and what intrigued you and your journey through this.
Yeah, sure. So when I was working at the Prostate Centre, they had some excellent therapists and urologists treating male pelvic pain. But the issue was I didn't feel it was really bespoke to the individual. Having had pelvic pain in my life, going back 12 years now, I just felt that there needed to be a little bit more of a bespoke approach to the patient, something that was more patient-focused, instead of just an off-the-shelf program that was vigorous prostate massage, antibiotics, and just packaged to the patient as that is the only thing to happen for you in order to get you through this. It didn't seem right to me. You know, we're not the same. Let's say there's 3 billion men in the world. We're not the same. There's going to be differences between us as well. So one of the things that makes a male are 3 main physical attributes. So a man has his cock and his 2 balls. And my outlook on my life changed when I lost a testicle to a horrendous infection in my mid-20s. On the brighter side of things, I've now got a nice purse or wallet I can carry around with me that I can put all my keys and phone and everything else in that I'll never ever lose. I don't put anything in there at all. I've definitely had nicer experiences, Susie. My pelvic pain was a massive turning point in my life. I was a therapist at the time. I was also coming out of being a tennis coach. So it was a massive shift for me. I was utterly devastated. It was very difficult for me to see any light at the end of the tunnel. Losing a testicle was a little bit like losing a stabilizer off your bike. I just felt I was going round and round in circles. I had anger and blame and resentment for the doctors and urologist and the hospital for turning me away at my first visit. And then fear, anxiety, shame and disgust at how I perceived my own deformed body and how my life would turn out. So this is now 12 or so years ago. I'm still here. I'm smiling, and I'm moving further forward with things as well. And now I'm using my experiences to bring that benefit and assistance to patients as well.
Absolutely, and you've got such an inspiring message to bring based on that experience, and the passion definitely seeps through, of course. And how did you overcome those struggles that you faced with the healthcare system and various healthcare professionals, and even your own personal beliefs about your self-esteem and body image during that time? What were some things that helped you through that time?
Yeah, so it was all those years ago. We're going back kind of 13 years ago now, so there wasn't much internet around. There was very little information. There were very few books around at the time. I was very frustrated and very angry with the urologist and GP. I didn't feel they were taking me seriously enough. And that I was told that, is it any surprise I should be in pain? Is it any surprise I should still be experiencing some of the symptoms I have? Pain around my pelvis, post-ejaculation, post-urination pain, a general ache across my perineum and up into my one ball. It just felt wrong down there. So was it any surprise that having had a massive infection where my testicle ended up the size of a grapefruit and then now disappeared down to a small cherry stone of just gnarly tissue, was it any surprise that I should now be experiencing pain above and beyond my infection? And I kind of ended up in a bit of a vicious cycle. I was really frustrated and fed up with the doctors and urologists, but I still had a life to be getting along with myself. And I'm actually quite grateful that there wasn't much internet around back then, that there wasn't a chance for me to read all those horror stories and to catastrophize and to really get into a bit of a vicious spiral, to realize that actually having support around you, having family, having sisters, having good friends are all part of that process to build you up. And you don't often realize that. Sometimes you're not really fully appreciative of what you do have around you, because when you have pelvic pain, the worst thing about it is you don't feel anyone understands you. On the face of it, you look healthy. You don't have your leg in a cast. You're not walking around with a back brace or in a wheelchair. So actually, on the face of it, people see that you look fine. What's the matter with you? So, and that takes a little while to get over as well.
Right, absolutely. And how important is that mindset, that shift in that mindset, to start moving away from being the victim, but actually being the driver of your health, and ultimately an expert in your own body and in your health, right?
Yeah, good question. And I'll always maintain my patients are they know their bodies far better than any expert will ever know their bodies. And that's it should be quite an empowering thing to hear, but it doesn't mean you're an expert in your own recovery. And that's why it's really important to have a qualified and experienced therapist to help you through this as well. It is important that you listen to yourself and you listen to what's going on as well, that your body is giving you signs and symptoms all the time, but quite often we don't know how to interpret that. We don't know the language of our bodies and what we need to do to understand that in order to move further forward as well. But having said that, use those resources around you. If you're having a bit of a crappy day, then go and tell someone. Go and tell those people close to you, because I see patients whose partners don't know they've got pelvic pain. And they've had this for kind of 3 or 4 years now, and their partner, their life partner, the people who they go home to, they've got no idea what's going on for that individual, and that's really tough. So that person is, they're almost in their own prison. They're wrapped up in what's going on up here and physically, and then that becomes more of a mental prison and more of a physical restriction. It's just, it's talk about it. That's as much as I can say. And us guys, Susie, you're a girl. You hang around with your girlfriends. You're used to talking about things. You're a physiotherapist. You're used to talking about how your body responds. Right. But we don't do that. We don't go down to the pub or to the bar and say, "So, guys, how's your backside doing today? Are you still getting painful ejaculation? Can you still sit down, or does it feel like a poker's going up your back?" We just don't do it.
Right.
And that's a real shame. We're too masculine to do that.
Right. And I think you hit the nail on the head with that one. It's communication and being open, and finding that support system. And I find many of my male patients and clients also have found that the most important things were acceptance, but also acceptance and support that they receive from others, and realizing that support system is there as a almost, I don't want to say a crutch, but something to fall back on when shit hits the fan, when you're having a really bad and shitty day. So
yeah, that's right. We should be able to vent. We should be able to get angry and frustrated and things like that as well. But we need to be able to do that in a supportive network, and to be able to tell people that. Now, I see patients whose family situations have broken down, and they're so removed geographically and emotionally from people that are around them. So they've limited their friends. In fact, quite often they might be housebound. Their family members are too far away and have their own health issues going on. So it can be very, very isolatory. And that's where chat rooms can work, and forums can be very beneficial, but they can be quite negative as well. It's using them for your best ability, really, to be able to get as much out of it as possible.
Right, absolutely, and finding what works for you.
Totally, because everyone's different. Everyone's different.
Right. I wish there was a cookie cutter protocol. It would be much easier.
Easier, wouldn't it?
Yeah.
One size fits all.
Right. Unfortunately not. But yes. So, in going back to, at what point, I think you mentioned maybe in your blog post, which was why I posed this question, but at what point, when did you realize that something in your lifestyle had to change?
Yeah, good question. Yeah, I was 26 when it happened. So, like any 26-year-old, you feel you're invincible. You feel you can do anything, and you feel you can go and go out on a Friday night and come back on a Sunday night and get up and go to work the following day and deal with all that stuff and crap in the meantime. And I kind of knew my lifestyle wasn't great. I knew I wasn't doing the right things. But my reality check was waking up and in hospital and thinking, I need to do something different here. The stark, cold, harsh reality of seeing a part of my body blow up to something, 20 times the size it should be, and then seeing it shrink down to a mere fraction of what it should be as well was just horrific. So I knew I wasn't doing the right things. And that's the beauty of the body. I mentioned this earlier on. The body tells us all the time that we're probably not doing what we should be doing. It's not really beneficial for us. But we don't really know how to listen to those cues. So at 26 years old, full of beans, full of the dream of life, and just thinking I was Superman. But, we're not. And sometimes it takes something like that for you to realise that.
Absolutely. I am right there with you. Like the subtle, I think that in the world that we live in right now, with all the distractions and busyness of our lives, as you put it, our minds, the language that our body is trying to speak to us is oftentimes put on the back burner. We're not paying attention to those subtle messages. And the nudges that we receive from the body. Ultimately, the pain sensation that you receive is more of a SOS wake-up call saying, hey, something's got to change now. I have to be louder and louder and louder for you to pay attention to me. Or, at least that's how I picture it.
No, totally, yeah, and it's almost like a little toddler. We've got a young one on the way, so I don't know this. I'm only told this, but it's almost like having a little toddler in the kitchen saying, Dad, and you don't really listen to it. So you kind of shrug it off and you get on with what you're doing, and then the child has to say, "Oh, come on, Dad, can you listen to me?" And the noise and the volume and that message to you gets louder and louder. But unless you know how to interpret it, then you're just going to shrug it off and just be like, "Oh, I'm going to ignore you. It's not that big an issue."
Mm-hmm. Right. Right, because at 26, you're invincible, right? 20s, early 20s, this can't happen to me kind of thing. And when it does, it can be quite catastrophic and scary, especially if you go through, oftentimes what you went through is seeing practitioners that weren't, I wouldn't want to say for you, but for most people, they weren't really guiding them into the right direction. And oftentimes, and I still get it today, where it's, well, you're just going to have to live with this for the rest of your life. I mean, I kid you not, I still get that on a daily basis.
It's a shocking message to hear, isn't it? No matter what's going on for you, to hear that message, to be feeling those sensations and that worry and that concern and that anxiety, and then just be told, look, this is just what your life is going to be like from now on. So you need to deal with this. You need to, kind of get on with your life as much as you can. The chances of you being in pain are really, really quite high. Mm-hmm. For me, what changed my mind, and I'm not saying this is where everyone should get to. This don't let it get to this particular stage. But the thought of me being a eunuch and not having any genitals at all was enough for me to think, I've already lost one testicle. I've got one left. I don't want to continue along this route. So that's what made me change. And I still have a beer, and I still go and socialise, and I still do spend too much time going out and having fun. But that's life. It has to be done in balance, though. And having that balance is really, really important.
Right, balance is the key. The journey of life and of health, right?
Not too much of one. We can't be enjoying ourselves all the time, sadly.
Right, absolutely. So you mentioned that at one point you were scared to tell your partner at the time about what was going on. Tell me a little bit about that and how you overcame that fear, or is that still something that is still on your mind?
It's a good question. Yeah, really, really good question. It's when I first met Nicole, my wife, I didn't introduce myself as, hi, I'm Carl. How are you doing? I've only got one ball. Would you like to see that? Come on. I didn't use it as a chat-up line. That's not how I got my wife.
Not an icebreaker.
I don't recommend other people to go around and expose themselves. That's not a good thing. My wife is a healthcare practitioner as well. She's a nutritionist. She does food intolerance testing. We met through work, so we've always had that nice health holistic approach, if you like. So for me, it was never an issue. I never had an issue telling her what was going on. She knew not from the off, but she, I felt comfortable enough to be able to speak to her about it. Now, not every male is going to be in the same situation. Not every guy is going to have that opportunity. Not every person is going to be able to go out and meet someone in healthcare. They are great people, so don't be afraid of going and meeting girls or guys in healthcare. They're really, really supportive, but don't focus yourself on that. You're a human being. So what I would suggest to you is that be honest, be the self first and foremost. That if we can't be honest with ourselves, then it's really, really difficult to be honest with anyone else at all. Right. I've been with Nicole now that's my wife, for 9 years. And certainly once I lost my testicle, I did find it really, really difficult. I wasn't looking for casual relationships. I wasn't looking for a relationship. Mm-hmm. I felt really, really awkward about myself and my body image. And the first sexual partner I had, I didn't even mention it to. So we met a few times. We were always pretty drunk at the time, and it was the only way I felt I had courage to have sex, or even to entertain the notion of having sex. The subject was never broached. She never mentioned it, and of course I never brought it up. And we kind of just drifted apart. I had one other fling before my first serious relationship before this. And for all intents and purposes, that ended up at success as well. But not all relationships are like that. And the first girl I ended up living with, this is really my history, isn't it? You're getting to hear about all my dating history.
Yes.
I'm laying it on the line for you. This is how it was.
I hope Nicole's okay with watching this.
I don't know. We'll have to ask her.
I'll make sure to delete anything you want me to.
I might need to come back and say, can we take all of this bit out?
Right. Too TMI, too much information.
Right. So the very first girl I ended up living with, there were a few issues with that, and we waited to have sex, and we booked a place away in the country, and we tried to make it as nice as possible for both of us. She knew what had happened, and again, I'd worked alongside her for a while. She was a personal trainer, and working in that kind of environment. But it all went that weekend away in the country was not a good weekend for me. I became very self-conscious. I think because it had been built up for such a long time, and maybe because this person I had feelings and emotions for this person, it meant an awful lot more. It changed over a few weeks, and I finally managed to get hard enough so as we could both have a bit of fun. But it wasn't easy. And she turned around to me and said, "Look, it's not your testicle I'm having sex with. It's all of you. There's more to you than just that single ball that's left." So, and that was a bit of a revelation. That we are more than our genitals. We're more than the sexual organs that make us males and females as well. That relationship disappeared, and then I met my wife, and we've had no issues around sex. I think because I dealt with that in the previous relationship. There's been no shortcomings, no anxieties, no fears, and no embarrassing, "Oh, look, honey, it's me, it's not you." There was none of that went on as well. So I'm extremely grateful. My advice to any guys out there is that your body is unique and individual. So no two guys are the same. That's what makes you who you are. That's what makes you an individual, right? And the world of the media portrays as a really airbrushed example of what they feel life should be like.
Absolutely.
It's a bit fantasy-like in that sense, that actually when you open a magazine or when you look at adverts, that actually what you're seeing isn't probably that real person. They've had so much work done to them that it can make a lot of guys feel really, really uncomfortable. And if you have pain in a place where you don't want it, then it's going to make you feel even more uncomfortable there as well. Pornography is much the same in this as well, and I do treat a number of patients that have porn addiction, and some of the process there is actually getting them to change their ideas and thoughts around themselves as well. So don't compare yourself to anyone else. Stop, and this is easy for me to say, stop checking yourself in the mirror every day. Stop looking for changes in the colour, the appearance of veins, the shape, the direction of bend of either your penis or your testicles. This is hypervigilance, and this only plays into some of the fears and anxieties, and it can leave you in that real vicious spiral again. And ultimately, whoever you end up with, they're not going to compare your genitals in their book of previous partners' genitals and say, "Well, listen, this is a different size, this is a different colour, this is a different shape." It just doesn't happen.
Right. So go on to talking about that. The catastrophizing is what I think you were getting at, just the vicious cycle of those negative thoughts that are and beliefs that keep looping around in your mind that can really spiral into driving you crazy, and ultimately disabling you, creating a disability, like you said, a jail or prison of oneself. What advice would you give, or how do you coach some of your clients through the catastrophizing and the beliefs and the thoughts? What strategies or things you find helpful for those who are in that kind of stuck in a rut? Can't get out of it.
Great question. Really, really good question. It's something so catastrophization itself is something that's not just specific to pelvic pain situations. It can happen in all kinds of situations. But we know it's really, really well documented now for long-standing or chronic or persistent pain. And studies have actually shown that catastrophization makes changes in our brains. So not only is it something that we feel emotionally and that we might feel, as you rightly said, trapped in our prisons, but it can change brain activity. So I'm going to give a little bit of science here.
Go for it. I love it.
The brain has different sections to it. And some studies have shown that changes in activity in the front right or right anterior and changes in the front left or left anterior part of the brain are associated with catastrophization around chronic pain over a long period of time. So activity in the left, this is my left, it is associated with feelings of joy and hope and increases in positive behaviour. and activity in the right part of the frontal brain is associated with feelings of anxiety and sadness and withdrawal from activity. So the study used an EEG machine to measure brainwave activity over a period of time. So patients who have been suffering from chronic pain and catastrophization. And actually what they found is something called alpha asymmetry. So this is a reduction in the left side of the brain activity and actually an increase in the right frontal part of the brain. So reduced feelings of joy, hope and positive behaviour and an increase in feelings associated with anxiety, fear and withdrawal behaviour as well. So not only when we get in those feelings in our tummy and those kind of butterfly feelings and really distracted thoughts, it actually changes the way our neurons work as well. So it's not, and that's important to realise with patients. And this is why when we give a little bit of pain science back, it's really, really important that we give some facts and figures to our patients as well to make them realise what's going on. Mm-hmm. That no matter what everyone else is telling you, that you're not nuts. Right. That you're okay, you're a human being. So science backs this up. And it is really, really difficult for patients. And I've been there, my patients will often say, there's nothing I can do, there's no hope, it's just awful. And I know these feelings only too well. I've been there, and you can really get stuck in a bit of a rut. So to tell patients, and to give patients examples around catastrophization and why they might withdraw from activities. And I certainly see some people who withdraw from activities, some from work, some from social activities. And sadly, I do, there are patients who disappear from life, who remove themselves from life as well. So here's just some examples. And I advise any therapist working with pain to use some of these examples as well. Context and dosage are really, really important in terms of dealing with catastrophization. So, all right, seeing a horror film in 3D in the cinema will make a patient who doesn't have pelvic pain uncomfortable, increased heart rate, jumpy, fidgety, nervous, and a bit panicky. Right? That's the deal with exactly like this. That's the deal with horror films. That's what they're supposed to be. Now, you put someone in that same cinema with pelvic pain and they're already feeling tense and unable to relax. And guess what? They're going to experience some increase in symptoms. Mm-hmm. So getting a patient to realise that is really, really important. Let's use the cinema again. So you've seen the film Minions. Have you seen Minions? Do you know the film Minions?
Minions? The Minions? Yes.
Yeah.
The little yellow guys?
That's right. Little yellow guys.
Yeah.
Now, you place a patient who doesn't have pelvic pain into the cinema watching Minions, and they're already relaxed, they're already more comfortable, they're already having a good time. You put a patient with pelvic pain, and they like to enjoy the cinema a little bit more. They're not going to be sitting on the edge of their seats. They haven't changed their body parts. They haven't, like Mr. Potato Head, they haven't got rid of their bladder or got rid of their perineum. It's the same perineum, the same bladder, but the context is very key as well. So let's look a little bit again at that same horror film. So now we've seen the film 5 times and we're watching it at home. You know where the jumpy parts are. You know what's going to happen. And if anything, you might find it a little bit more amusing or entertaining for different reasons now. Your pain response isn't going to be the same. It's going to be much, much lower because you're aware of that anticipation. You're aware when the jumpy bits are. You don't need to be tensing up all around that as well. Mm-hmm. Can I give a few more examples?
Absolutely. Yes, this is wonderful. Thank you.
My pleasure. This is what hopefully what will be beneficial for other patients and for other therapists listening to this as well. So 2 examples. Context is really key here. A bladder on a long haul flight or the bladder on a short haul hop on a plane. So the bladder's still the same. They haven't, like I said, it's not Mr. Potato pelvis. You haven't taken away a part of your body. You're still using the same part. But the context is really different. That a patient who goes on a short haul flight for 45 minutes may feel actually okay, I don't need to go and use the bathroom so much. But a long haul flight that's maybe delayed and you're circling around the airport before you come back in, if you've ever come into Heathrow, that's what happens there a lot. They're going to be feeling more anxious. They're going to want to pee more and more. Makes sense?
It totally makes sense. Yes. The context is really everything. And how you interpret that context, right? I mean...
Bingo.
You're interpreting it. From my understanding, pain is that sensation. It's a sensation, but you can choose to interpret it based on your fears, your anxieties, your previous experiences, what you've been told, how you were raised, and even to the extent of in utero. There are some, what the mother has gone through while you were just in the uterus. So, your genes also, but yeah.
Absolutely. So many things that we end up carrying around with us that will adapt our response in any given situation. I get a lot of patients say, I want to go and date again. I want to feel confident and happy about myself to be able to go and date again. And I say, that's great. But let's look at how your pelvic pain might react in a dating or bar situation. So, again, let's get rid of pelvic pain. Boom, gone. Piece of cake. Easy, right?
Right.
Let's look at a first date. So a patient is on a first date and they've got no pelvic pain. They're going to be feeling anxious, tense, expectant, excited, a little stressed, maybe some sweaty palms.
Yeah, butterflies in the stomach.
We all know those sensations. We all know those feelings. Now, you throw pelvic pain in there, and guess what? It's going to heighten that sensation. It's going to heighten those responses. Let's get rid of the first date for a second. Let's bring our mates into the bar. So same bar, same time, same day, and we're swapping our first date for mates. Mm-hmm. And we're going to feel much more comfortable in that situation. We're going to feel like we're able to express ourselves a little bit better. This is compared to having that first date. So we're going to feel more relaxed. We have more, there's less riding on the conversations and trying to impress that person. So therefore, we're less likely to feel anxious, and our bodily sensations and our body responses change. Again, we haven't changed anything in terms of our physicality. We're still the same person, but our response to that situation changes. So understanding those, and you're right, being aware of what's happening for us and how we interpret them is really, really important. It's quite hard to understand that in the situation that you find yourself in. Mm-hmm. So always try and take a step back.
Right, absolutely. And also giving yourself, I think, time and patience to train or to start living life in a different way. I think there's a learning curve with everything. And there, how when you go through stages of, it's like anger, grief, frustration, and then acceptance, and those models of understanding change, and also resistance, because oftentimes I feel like the resistance that we feel to change is actually a good thing. It means your body and your cells are changing, and you shouldn't give up when it gets really tough. It's like going to the first of the year, the new year. Everyone's got their resolutions, right? New Year's resolutions, and they're all in the gym. The first week they're all in the gym. The second week it's a little bit less crowded, and then as the month goes on, it's empty again. And it's kind of like you're all pumped up. The dopamine, all those stimulating neurotransmitters are like giving you all the yay, feel good, like this is good, I can do this. And then when you start to really make physical changes, structural changes, like you're saying, the neuroplasticity, the brain is going to have to change or retrain, and that could pose for a little bit of resistance. It's like a temper tantrum. Your body's like, wait a second, no, we're used to being loud and in charge, okay? Now you're telling me I need to quiet down?
Come on.
Right, yeah, like what are you talking about? Like, no, I'm not doing this. So that there does come a little bit of that learning curve, and I think of understanding and really being accepting of the good days and the bad days, and not getting too super excited and celebrate the good days, but also don't get really, really down on those really crummy days. It's a constant ebb and flow, but always getting better, like in that wave.
Totally, yeah, and it's easy for us as therapists to say that to our patients, and sometimes it takes a bit of a leap of faith from our patients to be able to get on board with this as well. Mm-hmm. You're right. We change from moment to moment, day to day, second to second. We're organic, aren't we? We're not like a door. We're not fixed in our motion. That actually we need to be adaptable and we need to change. It's what helps us learn language. It's what makes us be able to write and do complex skills. And there's so much that goes on. And knowing that there will be good days, and knowing that there'll be bad days is all part of recovery anyway. I use something called graded exposure, and I'm going to give you a quick example here of how graded exposure has worked with my patients, and can help to reduce that catastrophization. And instead of having peaks and troughs of pain and no pain and pain and no pain, it turns them into that beautiful wave-like motion that you mentioned earlier on as well, which is a lot easier to manage and deal with. So I'm going to use sitting. Sitting's an important thing for all of us to be able to do. It's very functional, and certainly for a lot of my patients, they struggle with sitting. So here's the thing. So if sitting for 30 minutes is the maximum amount of time that you're able to sit for, then that's your zone of tissue tolerance, right at the upper end of your zone of tissue tolerance. And that once you're sat for half an hour, then it's like it's kicking your pelvic pain. So we use graded exposure. And what I'm going to suggest is that if you start off, and this is individual, so it's important to work with a therapist for this as well, but if 30 minutes is your maximum time, drop it right back down to 10 minutes. All right, 10 minutes is comfortable. It's well within your comfort zone. It is a short time. I know that. And a lot of patients struggle with this. Well, I can sit for half an hour, so why are you getting me to sit for 10 minutes? Well, because we need to start somewhere. And sit on a hard, uncomfortable office or restaurant chair, those kind of things that we need to deal with in everyday life, but do it in the comfort of your own home. So feel safe and secure in your environment. And every day, increase that exposure to sitting for an extra minute. So start off with 10 minutes, then the next day do 11 minutes, 12 minutes, 13 minutes, and stick to it. And you might get a flare-up. And if you get a flare-up, then drop back 2 days and start again. And I've now got patients who are able to sit in meetings for hours without using a prostate cushion, something I'm sure a lot of male pelvic pain patients are aware of. I've got patients who can now go on flights for 2 or 3 hours that they'd never have considered doing before. And it's just through a little bit of this graded exposure, not sitting for an hour in a situation and then thinking, I can't sit anymore. That's catastrophization. That sitting in itself is not a bad thing. It's the context of where you sit and how long you sit for. And then this makes it a little bit more even, much more comfortable and manageable as well.
Right. Now, I have a question for you. So on that graded exposure, how do you help men that have pain after ejaculation? Or sometimes they might think that masturbating or sex is a bad thing, that they are aggravating or making their symptoms worse, or sometimes they even think that they created this problem for themselves because of masturbation. How would you respond to that?
Yeah, great question. Really, really good question. It's something that's central to so many guys that come and see me as well. So what the clinic I used to work at, and this has been central to quite a few patients who I've seen, that they were told to masturbate 4, 5, 6 times a day to help flush out that prostate, and most of them would be in agony, absolute agony. So it's just not productive. You're being told to do one thing, but actually on the other hand, it's not beneficial for you because it's setting up a pain cycle. Masturbation, sex, they're things that should cause us immense amounts of pleasure. So when a guy experiences pain and discomfort, it's very confusing. Do I have sex? I want to have sex, but actually it's like banging my willy on a door. It's, it's just not happy for me. It's something's not right. So they'll often think I'm broken. Mm-hmm. They might have fears about fertility and things like that as well. I get my patients, again, it's graded exposure. So if my patients have got porn addiction, which some of them have, then I suggest that actually ramping down and reducing from 5 to 6 times a day to change that behaviour is really, really important. And dosage is vitally a key here as well. For those that experience pain on ejaculation, I just get them to look at their situations a little bit more. So plan sex without being robotic, plan masturbation without being too robotic as well. And if you've got a loving, caring partner who's able to understand and appreciate you through this, and this is why it's important to talk to them about it, mm-hmm. that you can gauge that. Not all of us fancy sex all of the time.
Right.
And being mindful of that is really, really important as well. So look at a situation and So, if it's been a highly stressed week, if you've had poor sleep quality, if you've been out, if it's Friday night, you've had a belly full of beer and you've been clubbing, and then you come back, it's not a good idea to start shaking hands with the unemployed then. It's just not a good situation to be in.
I love it.
You're like to really, really, make things much, much worse for you.
Totally.
So think about the situation that you're in. Is it better to have sex with your partner on a Sunday when you've had a Saturday and a Sunday off? Instead of on a Tuesday or a Wednesday when you've had the beginning of the week and it's been crap at work and the boss is coming down on you hard and you've got these deadlines and you haven't been sleeping very well and you've been eating late at nights as well. So don't avoid sex. It's not damaging you. Or ejaculation. It's not damaging you. It's not making you worse when you realise things in context.
Right, absolutely. And sex is obviously it's a physiological function and it's healthy.
Definitely.
To do. It's a sump pump down there, so of course. But I think you hit it right on the nail on the head. Is saying it's context. It's going back to listening to the body and how are you feeling? Are you wired and tired, or are you relaxed? And if you're more relaxed, you're more likely to enjoy and have less symptoms of experiencing the things that you normally would experience without symptoms or without pain. Correct?
Totally, yeah, absolutely. And just because you have pain on ejaculation doesn't mean that you're damaging yourself any further.
Right.
And that's really, really important as well. And when you take a step back from it, the flare-up might only last a short space of time. It might only last a few hours, half an hour. For some patients, it might last a little bit longer than that. And that's likely because your system is so sensitized at that particular moment in time. And then the next time you ejaculate or have sex, it's not painful. So that's what blows patients' minds.
Yeah.
So take a step back, look at things prospectively as much as you possibly can.
Yes. Well, now that we're on the topic of bellies full of beer and sleep,
Yeah.
how important are those factors of lifestyle, so such as diet, sleep, fluid intake, exercise? How important are they for chronic pelvic pain syndrome and patients that experience that? What is your take on that?
Great question. And again, looking at a patient holistically, a patient isn't just their genitals. It's not a pair of genitals that walks into the room.
Yeah.
There's much more to that. They are attached to someone. And it's important to realise that as well. We know that there's strong links between poor sleep patterns and an increased response in chronic pain sensitivity. So getting sleep is vitally important. And some patients do experience difficulty getting off to sleep. So there's a number of different techniques and tools around that. Some patients do heavily rely on medication, and that's okay. But look at other more natural ways of doing that. So meditation, bit of mindfulness, listen to some relaxing music, do a little bit of yoga and things like that as well. In terms of diet and pelvic pain, every patient is different. So last month, I saw 3 patients who have now been referred on to a nutritionist. And there are some telltale signs that might indicate that they need to see a nutritionist or take a look at certain things. So they might be around bowel habits, and not exclusively, but combinations of the following. So heartburn, reflux, acid indigestion, varied bowel habits, so constipation to diarrhea, mucus in the stools, high gas levels, high bowel movements in a day, normally in excess of 3. Things like that might indicate that there's a bit of a bowel response happening here, and that we've sent those patients off to get food intolerance testing, and they're now seeing a nutritionist. So in about 10% of cases I see, there's a nutritional aspect to it. I would always advise patients to reduce things like diuretics. If you're having increased urinary symptoms and you're drinking 2 cans of Red Bull a day, followed by a large a grande from Starbucks or something like that, there are of course other coffee shops available, then you're going to be likely increasing that sensitivity in your bladder as well. So look at what you're doing. Drink lots of water, increase your fluid levels, and have everything in balance as well. It's about that balance. That having too high a number of simple carbohydrates, looking at getting good quality, more complex carbohydrates, have fats, have proteins, but make sure they're good fats and good proteins and not saturated fat. Don't have everything fried. Look at having things that are much more, we know what's healthy for us, right? And I think this is the key. There's so much information out there. We know what's good for us, but when we feel crappy, then sometimes we're going to turn and we're going to order that pizza, or we're going to go down to, a burger joint and get that burger as well. That's fine. That's absolutely fine. But dosage is key. 80% of the time be good, 20% of the time relax and enjoy yourself.
Right. Absolutely. That's wonderful. That's a great dose.
It works for me.
Right.
It used to be the other way around.
I think for many, me, myself included.
We need to enjoy ourselves.
Right, exactly. Live a little, but don't get too crazy, right? Oh my gosh. Well, and speaking, you mentioned medications. How antibiotics? It just kills me. Because many of these chronic prostatitis, chronic pelvic pain syndromes are often antibiotics are misused.
Yep.
And overabused, I think, prolonging the symptoms, and in my opinion, I think oftentimes potentially worsening the symptoms because of the gut microbiome. I mean, I'm huge on that as well. But what antibiotics do to the gut and the gut connection with the mind, and then and of course the pelvic floor, there's that whole connection. So what's your opinion on antibiotics and how they're used in chronic pelvic pain syndrome treatment?
Good question. I think antibiotics are necessary. I think antibiotics are really important for the human race. We wouldn't be where we are without the use of antibiotics. But they've got to be used in context again. And if 95%, up to 95% of all chronic pelvic pain cases are non-bacterial, and this is being so well documented now, why doctors put patients on antibiotics just as part of the course? Or we think you've got prostatitis, you've got prostatitis type symptoms. Here, take this dosage of ciprofloxacin, amoxicillin, doxycycline, and let's put you on it let's try 4 weeks to begin with, and then we'll come back and see. And then actually, it hasn't worked, your symptoms are still there. Let's try again. Let's give you a different dosage. There are tests out there, and there are really simple, easy, cost-effective tests that doctors and urologists are being told to use, but then or the reports I see from patients, it's just not happening. So there's a 4 or a 2-glass Stamy-Mears test. And the 4-glass is the old style test. It's 4 different samples in 4 glasses. It's the name 4-glass test. And now there's a 2-glass test, which the 2-glass Stamy-Mears test is a pre and post prostatic massage urine sample. And when compared between the 4-glass test and the 2-glass test, the 2-glass test is 96% as efficient as doing the 4-glass test, which is more expensive, more prolonged, and there's some shocking reports out there to say that actually urologists just aren't using this at all.
Yeah, and they're assessing the prostate fluid itself, correct?
That's right, yeah. So if there is a true prostatitis, as in what I mean by this is inflammation. Itis means inflammation. So laryngitis, tonsillitis, any word that you put itis on the end of it, there has to be an infection within that gland or part of the body for it to be called inflammatory and having an infection in it. And there's something called stewardship, and antibiotic stewardship at the moment is a big drive in the world of primary. So that over here is doctors, so the people who would like to see patients first of all, and then secondary healthcare providers, so urologists, neurologists, etc. There's a big incentive being put on that they should be mindful of how many antibiotics they're prescribing, and certainly around fluoroquinolines. So these are the likes of the ciprofloxacin, the levofloxacin, the really, really high potent. Ciprofloxacin is used to treat anthrax.
Wow, that puts it in perspective.
Yeah, it's just nuts. So why are they using it on something that's not even 95% of the time infected? It just doesn't make any sense to me. Now, let's reverse that for a second. If 95% of all cases were bacterial, then I could understand not necessarily doing the tests, right? vast majority, but it's the other way, that as little as 5 to 10% of the patients have a bacterial infection. So surely doing the right tests just eliminates that whole cascading effect of antibiotics, antidepressants, alpha blockers, known as the 3As. So that's what's often used now, 3As. Alpha blockers, antidepressants, and antibiotics, without even any testing in the first place. So par for the course. Ooh. So you've had prostatitis-type symptoms. Instead of running the test that will tell us that, let's just give you these. And in fact, instead of reviewing you in as little as 3 days, or even 2 weeks, which is what the protocols are, we're going to keep you on them for a month, 3 months. We're going to change them. Now you're on them for 6 months, a year. And I've got some patients who are just on them indefinitely.
Right, and I think that's just a little bit, it's a little overkill, and not to mention a lot of the studies, I've been doing a lot of my research on my own for this book, but they're no better than placebo.
No, there is only 3 studies out there at the moment in terms of antibiotics use, and you're absolutely right that the trials they gave on these, there was no significant difference between taking the drug, the antibiotic, and taking the placebo.
Right.
And in fact, the ciprofloxacin and the levofloxacin had no significant change in patient scores using something called the National Institute of Health Chronic Pain Score Index. There was no significant change, but it's just dished out left, right, and centre. So you have a book on the way, do you?
I do. I am writing it right now. It is all about. It's very tongue in cheek, written in a style that is funny and has a lot of analogies. Very much like what you're describing. For young men, in hopes to get the message out earlier, so that they don't have to suffer with these symptoms for years before getting the appropriate the help that they need. So my hope is to get it sooner than later, and to just educate them, just like your message, just educate them to have options and know what should and should not be done, instead of getting into this vicious cycle of something's wrong, they're not catching it, catastrophizing thoughts, anxiety, depression, which is very common. It's a common friend. You marry that when you're married to anxiety and depression once you're, kind of down that vicious spiral.
The lifelong sentence.
Yeah, right. And it doesn't have to be that way. It doesn't have to be that way.
It doesn't have to be that way. You're absolutely right. And I love the fact you're bringing out something that talks to and relates to the patient, using analogies and using stories and things like that as well, because that's so important, is that often patients will feel isolated, and that they'll often feel that maybe this is a life sentence now. Maybe this is just how things are going to be.
Right.
I've read stories on the internet. I've looked at blog posts. I've been on a chat room, and everyone else is saying the same thing. Yeah. So maybe this is it for me. I'm just going to have to put up with this, and that's not the right message. You're absolutely right. It's not the right message. There is hope, and so many patients come through my clinic, and I'm sure yours as well, that get great benefit, great relief. They're able to manage and reduce their symptoms and understand, and this is key, understand what their catalysts are for their pain as well.
Absolutely. The trigger. And a lot of my patients, just like yours, say the same thing. Once they realize the trigger, playing video games. One was playing video games. He's like, I never realized when I was playing video games late at night what my body felt. And now, after being educated and instructed on how to pay more attention to how your body's feeling during certain activities, they pick up on those things. It's like, oh my gosh, my whole body was tensing. And for no reason, because they're playing these video games. They're all into it, and their whole body is tensing, and their pelvic floor is tensing, and they don't even realize it.
And that's a great take-home, isn't it? It's a really, really important. So they're enjoying themselves and relaxing, stimulating themselves, absorbed in that situation. But actually, it's detrimental, and that's one of their triggers. As soon as patients realise this, then they're able to appreciate what's going on for them. And sure, I'm not saying stop playing video games, but just be mindful that actually it might be setting up a cascading event of pain and symptoms afterwards as well.
Right, or they can better control it. At that point, once they recognize, they can continue playing, but they can strategize by breathing differently, relaxing, and releasing the tension individually, so that relaxed awareness
And that's what it is. We spend so much time up here and focus on things externally that actually doing a quick body scan. So how is my pelvic floor feeling? Oh, hold on, it's a little bit tight. How's my back and shoulders feeling? Where are they? Are they up here?
Right, earmuffs. I always call these earmuffs.
Just being mindful of our bodies themselves as well. They're telling us all the time. It's just how we can listen to them.
Absolutely. So on that note, what other modalities do you find beneficial in treating your clients with pelvic pain syndrome?
Yeah, and it's really important that there are other modalities around us as well. I'm not the oracle. I'm not the answer to every single patient. I'm well aware of that, and I'm well aware that actually all therapists have their limitations, and that by having a good support network around us means that we can treat the individual. Because every presenting case is individual and should be viewed that way as well. As you said, there's not a cookie cutter type treatment that's suitable for every single person. So within the Pelvic Health group, there are a collection of other specialists that work in the same areas I do in London, and I've drawn other specialists in from there as well. So I have a nutritionist who I refer to, a CBT, an NLP therapist.
Could you tell the listeners what CBT is?
Yeah, of course. Yeah, sorry. So CBT stands for Cognitive Behavioural Therapy. It's around our thoughts and our behaviour and how our thoughts can dictate our behaviour and our behaviour can dictate our thoughts. So it's important to be shown adaptations to this. So be mindful, even being mindful in the first place can make us change our behaviour. And NLP, which stands for Neuro-Linguistic Programming, which is, again, fairly similar. It's about changing and resetting programs about how we deal with the environment that we're in. We can't change the environment, but we can change our response to it. I do have physiotherapists I refer to. I've got a biomechanist, a trauma expert, acupuncturist, and a microbiologist as well. And they're what kind of create the team around me that I'm able to refer patients to.
Excellent. Now, can you tell us a little bit about our Vigo massage?
Okay, yeah. So our Vigo massage is an indigenous. It was originally from Belize, so I had to. This is such a hardship. I had to go to Belize to learn some parts of the massage itself. I then travelled to Portland, up in Oregon, and then back down to Mexico as well. It's a very traditional form of abdominal and pelvic massage. And traditionally, it was for females and for female health. It's very specific for things like fertility and aiding fertility, and just because it's abdominal, because it's visceral, a lot of the organs can become a little bit gloopy and perhaps stuck together sounds the wrong thing. They're not fluid in their movements, and everything inside of us should be fluid. It should be able to move around and slide and glide really easily. The abdominal massage can just help to loosen it up and move it into the right place, whatever the right place might be. So everyone's individual. There's not a blueprint that we work from. It's external, it's very therapeutic, it's very relaxing, and the main principle behind it is actually part of self-care, that you teach the patient how to do a form of abdominal massage, and then they go back and they do the massage to their abdomen, and a few other bits and pieces. So there are some other modalities to it as well. But the patient then goes back and does that to themselves every single day. It's quite a small. There's I'm not sure. There's probably 1,500 therapists in the world at the moment offering it. It's a great treatment. It's where as you originally said in my introduction, it's where my kind of process began. And the original study I did into male pelvic pain was actually using our Vigo techniques. And the most important thing, the treatment's great, but I love the fact you get self-care. I love the fact that the patient becomes the driver in their recovery, that we're the sat-nav, if you like. And, we can take patients down the wrong route every now and again, but we're only there to guide. Ultimately, the patient is the driver in their recovery. They're the most important person, and the more involved they get in that, then the more likely they are to recover as well.
Right, absolutely. And how does this, because I work with I don't know if you've heard Barral Institute or visceral manipulation. I'm very involved with that. How different is our Vigo from visceral manipulation or Barral's perspective on working the viscera or the organs?
Yeah, good question. So the Vigo massage is very, very based around, although not exclusively, but it's very based around the uterus, the bladder, and in terms of the prostate. Now, we can't gain direct access to those. We don't really want to put our fingers inside there anyway, but we can't gain direct access to those organs. So we can gain approximate access. And what I mean by that is by lifting up and by stretching fascia and by stretching the connective tissue, you increase something called hemodynamics. So the very basic description is just increased blood flow. Increased blood flow brings oxygen to the area, and oxygen can change. So we have a receptor in the body that responds to changes in acid levels and pH levels within blood. And when there's compression of tissue, when there's lack of oxygen from lack of movement, then that can increase a pain response. And the idea with the Vigo massage, and I've done other visceral techniques as well. Marty Ryan's another great person who's done Love Your Gut seminars. He's another great person that does fantastic work. The idea is that you increase that slide and glide. You increase the potential for better hemodynamics and for improved oxygen distribution throughout those tissues as well.
That sounds yummy.
Yeah, it's making me feel hungry.
I know. Well, very good. Awesome. I think, and I'm just taking a gander at my questions. I guess let's move to, what are the top 3 things that you would say are the most important to start doing right off the bat when a man starts to experience pelvic pain?
Yeah. I rattled around inside my head for a long time to come up with just 3 things, and three's good. 3's a magic number. 3's easy to deal with. It's not 10 commandments. It's not a list of 20 chapters to follow as well.
Sure.
I think most importantly is to find out if there is something untoward, if there is a bacterial infection. So get yourself tested. If you do experience pelvic pain, try not to worry. So aches and pains are natural in the body. That's really important to remember. The aches and pains occur for us in the body all the time. My left knee is a little bit tender at the moment from running. I know it's transient, it won't be there all the time. Pain in the pelvis for males and for females is a little bit more alarming and catastrophizing. So get yourself tested. So go and visit, they're called gum clinics or sexual health clinics over here. Get yourself tested for any STDs, any STIs. Visit your doctor and urologist. Use these services and rule out any infection, viruses or growths, anything that needs to be treated, any red flags. So these are really important things that patients need to be made aware of, that if we can rule them out and all the tests come back positive, then you don't have any infection. The chances of you having an infection are so minute because you've had all the tests. And you might be put on a series of antibiotics or so on and so forth, but make sure you get tested and the right kind of tests.
Right.
That's one. Number 2, if there's no infection present, and that's been confirmed through the appropriate testing, then look at therapists with the experience and qualifications of treating male pelvic pain. Now, the chances are, because 95% of guys don't have bacterial infections, the chances are that this is the route you'll end up taking. That you'll end up working with a physical therapist, a manual therapist, maybe even some of those people I mentioned earlier on, the nutritionist, because every presenting case is unique and different as well. Read around. So on my website, I'll put a list of books and resources for the patient and for the professional. And there are a variety of different books on pain and pain education. Take a look on, and I'll give you the link at the end as well, but take a look, read around, become educated in this. And I don't just mean read Susie's book when it comes out. That's going to be a really, really good thing. Don't just stick to horror stories on the internet.
Right.
Those forums and those groups are great, but they can be very, very negative. And it's about dosage again. Read around, understand what's going on, but stick to clinical facts as well, and that's vitally important. And that's the reason why I put together that list of books. It's
a great list, by the way. I did read your article. Yeah, it's a wonderful list. It's a great compilation.
There's a spot waiting at the bottom for yours.
Yay!
And that's
I'm warning you, it is very tongue-in-cheek. I mean, I am very I'm speaking to the dudes here, to guys.
That's fine. That's fine. But the language is so important, isn't it? And there's no, because I'm a guy, because I'm able to talk to guys about things like that, does that make me a better therapist? I'm not sure it makes me any different from someone else who's able to talk to them in the right language.
Yeah.
And that's the difference as well, isn't it?
Yes.
That I may have a beard, I may have some parts of my genitals left, but I'm still not maybe the right person for everyone.
Right. Like I wrote, there's a part where I'm like, what do you know about male pelvic pain? You're a woman. I'm like, yeah, last time I checked, I don't have testicles or penis, but we're kind of, we are built in the same anatomical way, and I know a little bit about something down there, so.
Well, it's not the first time oh my God, I've never seen this before in my life.
Right. That's a surprise, So yes, I do look forward to that. And yeah, can you tell our listeners and our viewers and anyone out there how they can, what's your website, how they can reach you and follow you and contact you?
Yeah, of course. So the website is the Pelvic Pain Clinic, .co.uk. I am on Facebook. I am on Twitter as well. My Twitter feed is Prostatitis Help, and Facebook pages, surprise, surprise, I'm not very original with this. It's just the Pelvic Pain Clinic.
Very nice. You're straight and to the point, concise.
That's right, and I don't beat around the bush. I only treat guys at the moment. I have treated females in the past, but I want to focus my efforts and my attention to getting the right kind of treatment out there for guys, specifically with chronic non-bacterial prostatitis and chronic pelvic pain syndrome as well. They're something I believe we can make massive headway in, something that's poorly understood at the moment, but the evidence, the research, it's all out there. It's all transferable to chronic pelvic pain and to chronic prostatitis. So, and I get fantastic results in my patients.
That's wonderful. Well, you are quite the inspiration for myself and for others, I'm sure, and you have a very positive message that I hope you continue to bring into this world and just spread, because it is a very important one. And honestly, an inspiration, because if it was not for you and others who are in the same message to bring to the world to help others, I think I wouldn't be, doing what I'm doing right now and connecting with wonderful people like you. So I really appreciate it. I appreciate the time that you took out of your day to talk about your story, both personal and informative. And I hope to speak again soon.
Sounds good. I look forward to that. Thanks very much for having me, Susie. It's been great speaking to you as well.
Thank you, Karl.
You're welcome. Take care.